What if the person meant to save your life is secretly ending it? Patients mysteriously suffer fatal complications, while a wave of sudden deaths leaves staff terrified. Two health practitioners, hiding in plain sight, turn hospitals into their personal killing fields, and no one sees the evil lurking behind their scrubs. Dr. Reynaldo Ortiz was the kind of doctor you'd want in the operating room. Experienced, steady, and in control. He was not the type of man you would expect to be at the center of a medical murder investigation. But behind the polished surface of his medical career, Ortiz was a man with demons. Born in a small Texas town, he built his career from the ground up, earning respect as an anesthesiologist. Yet, as the years passed, cracks began to show. Ortiz had always been a man of intense pride who couldn't tolerate criticism. Colleagues described him as brilliant, but volatile, quick to anger when surgeries didn't go as planned, and always looking for someone else to blame. Outside the hospital, his personal life was even darker. He had been arrested multiple times for assaulting his partners. The first significant incident happened in 1995, when he was arrested for assault, causing bodily injury to his spouse. This was no minor dispute. Court records showed that Ortiz's violent behavior had caused physical harm to his wife, foreshadowing his lack of impulse control and violent tendencies that would later surface in far more terrifying ways. But Ortiz didn't stop there. A decade later, in 2005, another woman in his life, a second partner, filed for an emergency protective order against him. Despite this growing list of red flags, Ortiz continued to practice medicine without serious professional consequences. Then, in 2014, the spiral continued. Ortiz was arrested again, this time for domestic violence against yet another partner. But that year, it wasn't only his partner who suffered from his violent tendencies. In a fit of rage after a domestic dispute, Ortiz shot his neighbor's dog with a pellet gun. The neighbor had merely helped Ortiz's ex-girlfriend move out, and the dog became collateral damage in his uncontrolled fury. Ortiz was convicted of misdemeanor animal cruelty, a conviction that hinted at a disturbing lack of empathy. These incidents painted a picture of an increasingly dangerous man. His history of violence toward his partners, and even animals, demonstrated that Ortiz had a dark side, one that manifested whenever he felt powerless or challenged. But despite this record, Ortiz could maintain his medical license until he tried to renew in 2018. That's when the Texas Medical Board reprimanded him for failing to report his criminal charges. But this did nothing to stop him. Instead, the reprimand may have only deepened his resentment and sense of persecution, setting the stage for what would come next. By 2020, Ortiz's problems weren't confined to his personal life. In the professional sphere, his life was also unraveling. During a routine surgery that year, one of his patients required emergency resuscitation after an anesthesia-related complication. This was the type of life-threatening event that should never happen under an experienced anesthesiologist's watch. While the incident did not result in any immediate legal action, it began Ortiz's professional decline. In May of 2022, things reached a tipping point. Ortiz had become increasingly angry at the growing scrutiny surrounding his work. His colleagues at Baylor Scott and White Surgicare, a North Dallas surgical center, were beginning to question his abilities after several complaints about surgical complications. Ortiz confided in his peers that the investigation into his performance could ruin him financially if he lost his job. He believed he was being unfairly blamed for every complication and mistake in the operating room. This growing resentment, combined with the pressure of the ongoing investigation, pushed Ortiz into a state of desperation. It was around this time that his behavior took a sinister turn. In June 2022, the first significant catastrophe struck. Dr. Melanie Kaspar, another anesthesiologist and Ortiz's colleague, took home an IV bag from the clinic to treat her dehydration. She was feeling unwell and thought the IV would help her recover quickly. But soon after administering the IV to herself, she collapsed. Despite immediate medical intervention, Kaspar tragically died. Her death stunned the staff at Baylor Scott and White. She had no known health issues, and the suddenness of her collapse baffled her colleagues. It wasn't until toxicology reports came back that the horrifying truth emerged. The IV bag she had used wasn't filled with saline. It contained bupivacaine, a powerful anesthetic that, when administered intravenously, can cause cardiac arrest. Dr. Kaspar had unknowingly injected herself with a lethal dose of the drug. Around the same time as the doctor's death, the surgical center began to see an alarming increase in life-threatening cardiac emergencies among patients undergoing routine surgeries. These weren't isolated incidents. Between May and August 2022, at least 11 patients experienced sudden and severe complications during surgery, some of them young and healthy with no history of heart problems. Many of these patients went into cardiac arrest or experienced dangerous drops in blood pressure after receiving fluids through IVs. It was only due to the quick actions of medical staff that these patients survived. In one such case, a 39-year-old woman undergoing a routine procedure suddenly went into cardiac arrest after an IV was administered. Her heart stopped beating on the operating table, and doctors had to perform emergency resuscitation to save her life. She survived, but the experience left her and her family deeply traumatized. Another patient, a man in his mid-50s, came close to death during what should have been a simple surgery. Like the others, his heart began to fail shortly after he was given an IV. His family waited anxiously, unaware that what was happening on the operating table wasn't a medical complication. It was the result of a doctor's deliberate tampering. As more patients experienced cardiac crises, a pattern began to emerge. Each of the patients had been administered IV fluids shortly before their health deteriorated. That's when investigators were called in to examine the situation. When the IV bags from the affected surgeries were tested, they found traces of bupivacaine and other anesthetic drugs. Drugs that should never have been present in a basic saline IV. This discovery made it clear that someone was tampering with the medical supplies, and it wasn't long before suspicions fell on Ortiz. As investigators honed in on the IV bags, the suspicion that someone at the surgical center was deliberately sabotaging the supplies grew stronger. To uncover the truth, the hospital set up surveillance cameras in the storage area where the IV bags were kept. The breakthrough came in August 2022 when the cameras captured something shocking. On the surveillance camera, Ortiz could be seen placing IV bags into the warmer, an unusual action that no other staff member was recorded doing. In one critical video, Ortiz was seen putting an IV bag in the warmer and walking away. Later that same day, the IV bag was used during surgery, and the patient suffered a cardiac emergency. When the bag was tested, it was found to contain bupivacaine, the same drug that had killed Dr. Kaspar. The footage left little room for doubt. Ortiz had been deliberately tampering with the IV bags. Investigators now had evidence linking him directly to the sabotage that had endangered countless lives and resulted in the death of his colleague. It was a chilling realization. Ortiz wasn't just a frustrated doctor. He was a man willing to risk lives to satisfy his anger. On September 15th, 2022, federal agents arrived at Ortiz's home in Texas and arrested him. He was charged with tampering with a consumer product that resulted in death and serious bodily injury, as well as healthcare fraud. When the case went to court, the evidence was overwhelming. Prosecutors laid out a detailed timeline of events, beginning with the surveillance footage that captured Ortiz in the act of tampering with the IV bags. Toxicology reports further supported the case, confirming that the bags used in each cardiac emergency contained harmful drugs that should never have been in the IV solutions. In court, survivors of the cardiac emergencies testified about their harrowing experiences. One patient described the moment her heart stopped during surgery, her world going black as doctors rushed in to save her life. She recounted waking up in the ICU, confused and terrified, only to learn later that she had been the victim of medical sabotage. Another patient spoke of the emotional toll the incident had taken on his family, who had come close to losing him during a simple procedure that should have been routine. Dr. Kaspar's family also took the stand, sharing their grief over the sudden and senseless loss of a beloved wife and mother. The courtroom was filled with tension as they described the shock of learning that their loved one had been killed not by chance, but by the deliberate actions of a trusted colleague. In late 2023, the jury returned to its verdict. Dr. Reynaldo Ortiz was found guilty of tampering with a consumer product, resulting in death, as well as multiple counts of tampering that caused serious bodily injury. The evidence was overwhelming, and the jury did not doubt that Ortiz had knowingly and willfully put lives in danger. Ortiz was sentenced to life in prison, without the possibility of parole. His medical license was also revoked, ensuring that he would never again have the opportunity to harm another person. Jennifer Hall. A string of sudden deaths, a hospital in panic mode, and one woman stands at the center of it all. Jennifer Hall wasn't always the person shrouded in suspicion and criminal allegations. Born and raised in Shawnee, Kansas, Jennifer had a seemingly ordinary childhood, at least on the surface. As a teenager, her life took a turn when she left public school and was homeschooled through high school. Those who knew her during these years described her as attention-seeking and manipulative, traits that would follow into her adulthood. Her troubled behavior first caught the attention of authorities when she was convicted of arson in 2001. She was accused of setting fire to a hospital office at Cass Medical Center in Harrisonville, Missouri, after learning that a coworker she had accused of sexual harassment would not be disciplined. Just days before the fire, the coworker she'd accused died of a heart attack. His sudden death, combined with Jennifer's accusations, raised suspicions, though no formal investigation into his death was conducted due to his cremation. This early brush with the law hinted at the lengths she might go when she felt wronged. In December 2001, shortly after her arson conviction, she was hired as a respiratory therapist at Hedrick Medical Center in Chillicothe, Missouri. This small hospital, serving a town of just over 9,000 residents, had a quiet history, until Jennifer arrived. Over the next 5 months, the hospital experienced an unprecedented surge in code blue incidents, emergencies involving sudden cardiac arrest. In a hospital that typically saw one code blue a year, there were 18 such incidents between December 2001 and May 2002. The deaths of 9 patients during this period raised immediate red flags. Among the victims was 88-year-old World War II veteran Charles O'Hara, who was admitted with high temperatures and agitation, only to die 2 days later. Then there was David Harper, a 37-year-old pneumonia patient who was on the verge of being discharged when he suddenly died. Similarly, 49-year-old Shirley Eller, who was expected to go home after being treated for pneumonia, collapsed and died just a day before her scheduled discharge. The most disturbing case was that of a 75-year-old Fern Franco, who was found dead on May 18, 2002. An autopsy later revealed that Franco had been given lethal doses of sicanylcholine, a drug that paralyzes respiratory muscles, and morphine, leading to her suffocation. Jennifer quickly became the focus of suspicion. Hospital staff noticed that she was always present during the code blue emergencies. Some even described how she seemed to relish the chaos of these critical moments. The fact that the number of cardiac arrest incidents dropped back to normal after she was placed on administrative leave only intensified these suspicions. Despite the circumstantial evidence, there was no concrete proof that she was responsible for administering the fatal drugs. As a respiratory therapist, she did not have direct access to the medications found in Franco's system, which made it challenging to pin the blame on her. However, Jen's history, including her arson conviction and the troubling coincidence of her proximity to the patients who died, made her a prime suspect. Wary of the potential scandal, hospital officials did not immediately launch a criminal investigation. Instead, they placed her on admin leave, citing her criminal background as the reason rather than the spike in patient deaths. Her MO was chillingly straightforward: exploit her position as a healthcare worker to gain access to vulnerable patients, then administer lethal doses of drugs that would cause sudden respiratory failure. The fact that these patients were already in fragile health made their deaths seem, at first glance, like unfortunate but natural occurrences. Despite the mounting suspicions, the case against her stalled for nearly 2 decades. The lack of evidence and the hospital's initial reluctance to pursue a criminal investigation allowed Jennifer to remain free. On top of that, the wrongful death lawsuits filed by the victims' families in 2010 were dismissed by the Missouri Supreme Court in 2019. further delaying any resolution. It wasn't until 2019 when a veteran detective took a renewed interest in the case that momentum began to build. The detective re-examined the details of Jennifer's life and the deaths at Heydrich Medical Center, looking for anything that had been missed. Jennifer was eventually linked to Fern Franco's murder primarily through circumstantial evidence and medical findings. Franco's autopsy revealed lethal doses of cyclopentine and morphine, drugs she was not prescribed. Investigators also noted that Jennifer was present during all of these suspicious code blue incidents at the hospital. Further scrutiny of Jennifer's behavior and the dramatic spike in code blue cases while she was on duty strengthened the suspicion that she had indeed administered the fatal drugs. In 2022, Jennifer was finally arrested, 20 years after the code blue deaths. She was charged with first-degree murder in the death of Fern Franco, though authorities continue to investigate her potential involvement in the other suspicious deaths. Jennifer's life after Heydrich Medical Center was marked by continued turmoil. She faced numerous legal complaints, including allegations of violent and erratic behavior. She was accused of trying to run a former brother-in-law off the road. In another disturbing incident, she allegedly stole the cremated remains of a man she had a relationship with and fired a gun in the house of another of her love interests. These actions painted a picture of a woman who was not only deeply troubled, but also calculated and dangerous. Jennifer managed to avoid a life sentence by accepting a plea deal in October 2023, where she pleaded guilty to causing the deaths of 2 patients. By pleading guilty, Jennifer received 18 years in prison, rather than a life sentence if convicted at trial.